Hello everyone and welcome to Medic Didactic, and today our topic of choice is respiratory physiology. I'm going to be doing a respiratory series and talking about all sorts of different pathophysiologies with the respiratory system and how to fix them. Respiratory being our pulmonary system and physiology being how it works when it isn't broken. So today we're just talking about the basic steps of bringing oxygen from the outside world and into our lungs. This is the pulmonary system. Our bodies need oxygen to metabolize. Every single process in our body needs oxygen. Without it, our cells will die. It is the respiratory system's job to take oxygen from the outside world and bring it into the body on a cellular level. The way the body does this is through three steps that may or may not be simple: ventilation, respiration, and oxygenation. I'd say they're not very simple, but ventilation is the simplest of the three. When all three of these systems are working, our cells are happy. Just like that little happy face there. How does the oxygen get to the cells from the outside world? Ventilation is the first step. It is the physical movement of air in and out of the lungs. This is done through a mechanical process of air pressures. If your diaphragm flexes, there is a higher air pressure outside than there is inside your body, and that basically draws in the air. That's the inspiration phase. Respiration is the exchange of gases, carbon dioxide and oxygen, in the alveolar sacs inside the lungs. At the smallest level inside your lungs, there are these little sacs called alveoli, and when those sacs are blown up, they are filled with carbon dioxide, and oxygen likes to go from an area of high concentration to low concentration. That's where the gas exchange takes place. Oxygenation is the exchange of gas once it's on the hemoglobin and in the circulatory system to the cells outside of the circulatory system. So everything outside of your blood, your skin, your bone, your everything. Ventilation, our first step. As a pre-hospital provider, it is quite easy to remember that ventilation is mechanical because we are actually doing this with a bag valve mask. And when you're physically squeezing that mask, the air is going inside the patient's lungs and you're bagging it in. So that's right there, bag valve mask. You'd put that over the face and squeeze the bag. That pushes the air into the lungs, and that is ventilation. Respiration. The gas exchange in the lungs is possible due to the concept called diffusion. There's a higher concentration of carbon dioxide in the pulmonary tract because that blood has already been through the body. Since it's already given all of its oxygen to the cells, the hemoglobin has been bound with CO2, and that blood is considered deoxygenated. This causes there to be a higher concentration of oxygen in the lungs and a lower concentration in the alveolar sacs. And by nature, diffusion, the oxygen moves from an area of higher concentration to lower concentration. Just like that animation there, the laws of nature, everything wants to be spread out evenly, and if there is no oxygen in the alveoli and there's oxygen in the lungs, it'll push the CO2 out and bind to the hemoglobin. Oxygenation, or perfusion as some books call it. Once the oxygen is bound to the hemoglobin, the blood then flows back to the heart through numerous pathways, through the left atria and then eventually through the left ventricle. This pushes the oxygenated blood out to the rest of the body to work on oxygenating cells. Again, through the process of diffusion, the oxygen will leave the hemoglobin to an area of lower concentration where the cells need oxygen throughout the body. Once a cell has been oxygenated, this is the final step in the pulmonary tract, and the deoxygenated blood then flows back to the lungs to be reoxygenated. Ventilation, that whole system, it's just a giant circle. Where does the pathophysiology come in? There are so many different types of pathophysiologies that cause people to not oxygenate their cells correctly. Now that we've talked about how the respiratory system works on a basic level, we can talk about different ways that pathos impede that system from working. In the next video, we will be talking about COPD, chronic obstructive pulmonary disorder. Thank you for watching, and if you found this video helpful, give it a thumbs up. Have a good one.